afternoon. Dr. Arvind here. Today I'm going to talk something about relative energy deficiency in sport, which is also known as RADS. I'll name it as RADS from here on, which used to be famously known as Female Athlete Triad, simply because it used to be highly related to female athletes who are into aesthetics. You're talking about gymnasts, you're talking about ballerinas, female bodybuilders, especially the figure bodybuilders, who have difficulty or restraints with food, and that goes on to affect their menstrual function and also their bone health. Now, the IOC, which is the International Olympic Committee, thought that this was not the end of the spectrum. There was more to it. There was things that were affecting not just their menstrual function or their bone health. It was also affecting their neurological status, their endocrine function, metabolic function, psychological function, hematological growth and development in younger females, cardiovascular, and also their GI tract. And what they noted that there was a lot of females who were in this restricted diet pattern because of them trying to make weight or trying to be thin because of their particular sport. They started to see a lot of these women having menstrual dysfunctions. Basically, what happens is they do not get their menses for 3 to 4 months in a row, and what was some of them think is normal, it isn't actually. And this was highly related to the fact that their energy availability was very, very low. They were not eating enough to actually make up for the energy that's being used up. So this caused alteration to what we call as the hypothalamus pituitary gonadal axis. And when that started happening, we realized that these women started to have secondary amenorrhea. Basically, what happens is they don't 90 days of no period or more. And when this happens, it doesn't only affect the estrogen and progesterone levels in the body, it also affects the other hormones that are produced in the body, namely like thyroid hormones. It also causes a raised levels of cortisol. It causes a raised level of growth hormone, but at the same time, there's also resistance to this growth hormone function. And this is normally seen in females who take calories less than 30 kilocalories per kg lean mass. And you see some of them taking up to 25 kilocalories per kg lean mass, which is very, very low. Normal people can go between 35 to 50 kilocalories per kg lean mass. And this actually negatively impacts not only their menstrual function, but the endocrine function as well. As I was saying, it causes also decrease in insulin or insulin-like growth factors, which also plays a very huge role in not only growth but also performance. Now, when we talk about bone health, we're talking about bone mineral density. And in these women, you realize that because of the lack of estrogen, there was an alteration in the architecture of the bone, and they demonstrated actually low bone mineral density. And when you have low bone mineral density, what happens is your risk for stress fractures and even fractures per se increases. And this is also commonly seen in sporting population, not only in females, also in males who have restricted caloric intake for a long period of time. And other things that you will actually see is they will have decreased resting metabolic rate. Basically, when your energy expenditure is too high and your intake is too low, your body eventually has to adapt and starts reducing the resting metabolic rate. And this increases hormones like ghrelin, which is your hunger hormone, and makes you really, really hungry. And other things that's associated with RADS syndrome is even you have low energy intake or low energy availability due to your diet, you also have things like iron deficiency syndrome, which causes anemia, which then impairs the oxygen transport, and that eventually impairs your aerobic capacity. And that eventually, if you're an endurance athlete, aerobic capacity is one of the biggest things that dictates your performance, and that is also affected. Okay. Then the other things that you'll see in younger females who are in their adolescence, who are still growing, starting to have stunted growth, simply because the dietary restriction is affecting the hormones that actually helps with growth, especially like decreased IGF-1, increased GH resistance, and this highly associated with things like anorexia nervosa. And other things that you'll see that in females, the estrogen has a protective effect on their heart and their endothelial health. So you see them having a lot more arthrogenicity, endothelial dysfunction, and impaired lipid profiles. And this actually normally reversed once their dietary intake improves and the menses actually comes back to normal. Other things that's common is you will see them having GI issues like constipation because of delayed gastric emptying and so on. And this itself can be very, very difficult, simply because you will think that they're having all the fiber in the world. However, they're still constipated all the time, and this has been actually associated with low energy availability, which is red S syndrome. And besides that, you will see them having flu and fever quite commonly, and this is because low energy availability eventually affects also the immunological function. So this has an indirect effect in their performance as well. And last but not least is the psychological effect. And athletes who are facing this kind of dietary restrictions eventually will fall into problems with depression, so low social security. They will have inability to manage stress very well. They get very irritable and so on and so forth. So this is actually pertaining to the fact that there's so much hormonal dysfunction that's going on when you have low energy availability, and this can eventually affect their performance. So, and this is normally coupled with either disordered eating or eating disorders like anorexia nervosa, bulimia nervosa. And if you see an athlete with red S syndrome, normally they will have impaired muscular function, never optimal muscle mass, poor glycogen storage, poor protein synthesis, which then goes on to affect their neuromuscular function, their strength, their speed, their endurance, and so on. So this is actually very important. Making weight has become so important that some of them actually do not take into account how important adequate calories is to maintain general health and also performance. So as coaches and trainers, you need to identify this early and refer to doctors if you see that your athlete has eating disorders or disordered eating, which is actually affecting not only their performance, but you see their menses are irregular and so on. If you find out these are things that's happening, you should refer to doctors, and so that we can actually go on and investigate how we can help this athlete. We might also refer the athlete to a psychiatrist and also a dietitian to help in rectifying the problem and getting them out of it, because most of the time it's actually it's a fear because of peer pressure, because of needing to perform, because of needing to make weight and so on. They go on to have eating disorders, which eventually causes this red S syndrome, and eventually causes a lot of problem and may halt their performance or their improvement in sports. So all of us have a responsibility to ensure that this doesn't go on for too long and affect their future. Thank you.